Now I wish to show you a very interesting variety of neck, back and hip muscle distortions which I find to be different in every single rigidity autoimmune patient I treat. Even many massage therapists who work with muscles all the time are not aware that the swelling, inflammation, atrophy or tenderness of each individual muscle in the torso of a rigidity autoimmune patient reveals a very interesting problematic story in the makeup of rigidity autoimmune symptoms and diseases. For patients or practitioners to learn the art of reading the interesting reasoning behind these distortions is to open all the doors of understanding in relation to rigidity, autoimmune symptoms and disorders. Let's have a look at these muscle distortions here. The first musculoskeletal photo I want to show you is that of Ross Collins. If you take a look at Ross's photo here, you can see I've marked 1, 2, 3, 4 and 5 different columns of muscle tension that are swollen, causing his shoulder blade to lift out and causing his left hip bone to be pulled up. Now if you look at Ross's hands, you can really see a lot of white blotches all over both palms, which indicates kidney stress. And Ross also had a lot of back pain affecting his kidneys. My next client is Nancy, who was diagnosed with transverse myelitis. Okay, so quite different from Ross. Nancy has one large swollen area of muscle causing a thoracic curve here, and extended from that is this area going right up to the lateral border of the trapezius muscle, where her initial problem began, which caused subluxations at both the C1 and the C2 vertebra and a subluxation at the T7 vertebra. This is Nancy's cervical x-ray. You can see where Nancy's cervical spine has straightened right out. It's like in a straight line, whilst it should be curved like this yellow dotted line here. So the next one I would like to show you is George, who was diagnosed with Lou Gehrig's syndrome. Now George also reported that he had neck problems preceding the onset of his first symptom. And if you look at his neck, you can see excess muscle tension in the left trapezius muscle. You can see 2 kinks in his lower cervical spine and upper thoracic spine. And you can see how he also has a twisted pelvis. Now if you look at George's hand, you can see those same kidney dots all over both palms of his hands. So now I would like to show you musculoskeletal problems associated with MS patient Tiffany. The first problem that Tiffany noticed just prior to her first symptom developing was a pain from the base of her skull all the way down the right trapezius muscle and across part of the shoulder. And if you look closely now, you can see Tiffany's got 2 kinks there in her upper thoracic, very much the same as George with Lou Gehrig's. Then she's also got a twisted pelvis, her left shoulder blade is protruding, and she has a severe bend at her L1 vertebra. Okay, so the next one I would like to show you is sarcoidosis lung disease patient Bart Stolworthy. And once again, his very first problem just prior to his first symptom developing was excess neck muscle tension, and just like Tiffany, his excess tension began also on the right side of his neck and halfway along his trapezius muscle towards the shoulder joint. So there's a close-up of the trapezius tension that's been with him right from the beginning, even before his first symptom developed. Then you see a second column of tension, part of the trapezius and the rhomboid muscle, and another column of tension going all the way out to his right hip, which pulled his right hip up in the air and caused him to develop a twisted pelvis. Now once again, with Bart's cervical x-ray, you can see that his cervical spine is actually starting to bend the other way, which is called kyphosis. See that there? I put the ruler, it's easy to see that it's actually bending the other way. It's actually becoming kyphotic. That will be causing trouble to many different nerves exiting the spine, which once again can cause any number of symptoms from the top of the head right down to the feet. Okay, so my next photo is of Janice, who was diagnosed with Chung-Strauss syndrome, and just as you was seen in the other 5 photos on this board here, Janice also had a variety of excess muscle tensions that were protruding from one side of her back and pulling on her spine to cause her symptoms. If you take a close look at the pattern across Janice's back, you can see the trapezius muscle is really tight on the right side of the neck. There are several muscle protrusions around the shoulder blade area and the base of the neck here that are seen to really stick out when compared with the other side. And Janice also has 2 kinks in her mid-thoracic area, which combined with the misalignment at the C1 and C2 vertebra at the base of her skull and all this tension on the right side, ended up putting her in a wheelchair. So I want you to understand the incredible amount of information that I gained on each of these 6 patients by looking at their muscular patterns on their back to see what the spinal supportive muscles were doing to their skeletal frame, the kidney dots showing on their hands, the iris signs that I found in their eyes, combined with their x-rays, blood pressure and oxygen saturation readings, and last but not least, all the blocked nerves that I found in their system when I pressed on a variety of nerve junctions relative to the symptoms they experienced and the muscles that I found that weren't operating properly. So you can actually see how Ross has his own pattern, like a fingerprint of problems in the back that were calling out to me, telling me what I needed to do to help him. Nancy the same. She had her own pattern, like a fingerprint of problems that were calling out, telling me what I needed to do to help her. And Tiffany with MS, the same thing. A collection of problems screaming out at me from her back, from her hands, from the iris of her eyes, from her x-rays, telling me everything I needed to know to put her in remission. The same with Bart. Watch Bart's before and after success video on my website. He reached remission in 5 days and said goodbye to the symptoms of sarcoidosis lung disease. In every single Parkinson's and MS patient I've treated, I've found excess of tension in the spinal supportive muscles from the neck down to the hips, numerous blocked nerve junctions in the nerves of the torso and limbs, and abnormalities in the spinal column. And when I correct these problems, along with the anxiety and stress that caused them, the symptoms start to go away. Now I'd like to show you some before and after spinal photos on day 1 and day 5 of treatment that show how reduction in symptoms is proportional to musculoskeletal improvement. This is Rigu. Rigu has 5 misalignments with a massive column of tension on the left side pulling his spine over, and he can't walk. On day 5 the misalignments are all gone, 80% of his tension on the left side is gone, and he can walk. This is Tiffany. Tiffany has 6 misalignments in her spine and excess muscle tension on the right side of her lower spine and the left side of her neck. On day 5, she only has 2 minor misalignments, but all the excess tension is gone. Day 1, she couldn't walk, and day 5, she could walk. The same with Barry. Multiple misalignments in his spine with a major kink at the cervical. All the misalignments are gone on day 5. Most of the excess muscle tension is gone on day 5. He wasn't able to walk on day 1. He can walk on day 5. This is Ross. He has 6 misalignments on day 1 and a massive column of excess tension all the way down from his trapezius to his lumbar area. He couldn't walk, and on day 5 he has no misalignments and 90% of the tension is gone and he can walk. There is a new era on the way, a new learning that will enable the natural health industry to help people like never before. We should not be in this industry just to make an income. We need to have our heart in our work and reach through to the soul of the people we treat to really make a difference. Practitioners of tomorrow need to know the spine and how muscles influence the spine. They need to know that different thoughts influence a release of different hormones that all have a different effect on the body's immune system. They need to learn about the prefrontal cortex, the orbitofrontal cortex, the dorsolateral convexity, the substantia nigra, the locus coeruleus, the amygdala and the hypothalamus, and what these different brain sections do to the immune system and how they can work to improve the efficiency of these different brain functions in overcoming muscular rigidity autoimmune disorders. They need to learn about the heart and the spirit of a person and how to overcome all aspects of ill health, right down to love and romance in a relationship. Pills and surgery will never fix the problems that create muscular rigidity autoimmune disorders. Only chiropractors working side by side with natural autoimmune practitioners can do this work. These autoimmune patients are going through terrible suffering and they need hope, faith and encouragement with promising, truthful facts that can help them, like the ones here documented in Dr. Parkinson's book. This is not a book to be ignored like it has been. It is a book that should be referred to in every medical, chiropractic and natural therapy college on the planet. In my opinion, the reason there are so many muscular rigidity autoimmune disorders that are classed as incurable is because the autopsy findings documented in this book have been ignored for all these years. The results of my 5-day treatment program, which are based on the writings of this book, in putting many patients into remission in only 5 to 7 days, is proof beyond doubt that Dr. Parkinson was right.